Question 1. A nurse is caring for a patient with hypoparathyroidism. Which dietary recommendation is most appropriate? A. Increase intake of spinach and chocolate. B. Limit dairy products. C. Eat foods rich in calcium and low in phosphorus. D. Avoid vitamin D supplements. Answer: C. Eat foods rich in calcium and low in phosphorus. Question 2. A patient with diabetes mellitus is prescribed Lispro insulin. When should the nurse administer this medication? A. At bedtime. B. 15 minutes before meals. C. 1 hour after meals. D. Only if blood glucose exceeds 200 milligrams per deciliter. Answer: B. 15 minutes before meals. Question 3. The nurse assesses a patient with hyperthyroidism and notes restlessness, weight loss, and heat intolerance. Which lab value supports this diagnosis? A. Decreased TSH, elevated T3 and T4. B. Increased TSH, decreased T3 and T4. C. Normal TSH, elevated calcium. D. Elevated cortisol and ACTH. Answer: A. Decreased TSH, elevated T3 and T4. Question 4. A nurse receives an order for radioactive iodine for a patient with Graves' disease. What should the nurse include in the teaching? A. You can be around children immediately after treatment. B. Expect improvement within 12 hours. C. Sleep in a separate bed for several days after treatment. D. Continue antithyroid drugs indefinitely. Answer: C. Sleep in a separate bed for several days after treatment. Question 5. A patient is receiving vasopressin for diabetes insipidus. Which finding indicates therapeutic effectiveness? A. Decreased blood pressure. B. Increased serum sodium. C. Decreased urine output. D. Increased thirst. Answer: C. Decreased urine output. Question 6. A nurse is caring for a patient with primary hyperaldosteronism. Which clinical finding is expected? A. Hyperkalemia. B. Hypertension. C. Bradycardia. D. Hypovolemia. Answer: B. Hypertension. Question 7. Which gland is responsible for regulating circadian rhythms? A. Pituitary gland. B. Pineal gland. C. Thyroid gland. D. Adrenal cortex. Answer: B. Pineal gland. Question 8. A nurse is caring for a diabetic patient who is NPO for surgery. What should the nurse do regarding the patient's scheduled insulin? A. Administer full dose of all insulin. B. Hold all insulin until after surgery. C. Clarify insulin orders with the provider. D. Give oral glucose instead. Answer: C. Clarify insulin orders with the provider. Question 9. Which finding in a patient with chronic corticosteroid use requires immediate attention? A. Blood glucose of 155 milligrams per deciliter. B. Blood pressure of 145/88 mmHg. C. Red, painful leg with swelling. D. Weight gain of 2 pounds in a week. Answer: C. Red, painful leg with swelling. Question 10. A nurse is teaching about the role of the anterior pituitary. Which hormone is produced there? A. Oxytocin. B. ADH. C. TSH. D. Insulin. Answer: C. TSH. Question 11. A patient with newly diagnosed type 2 diabetes is prescribed metformin. Which instruction should the nurse give? A. Take this medication with meals to avoid GI upset. B. This medication may cause hypoglycemia. C. You should avoid all carbohydrates while on this drug. D. Take this medication only when blood sugar is over 250. Answer: A. Take this medication with meals to avoid GI upset. Question 12. Which hormone is primarily responsible for lowering blood glucose levels? A. Glucagon. B. Insulin. C. Cortisol. D. Epinephrine. Answer: B. Insulin. Question 13. A patient presents with a goiter and fatigue. Which dietary intake likely contributed to this condition? A. High iodine. B. Low calcium. C. Low iodine. D. High phosphorus. Answer: C. Low iodine. Question 14. A nurse is caring for a patient with acromegaly. Which symptoms should the nurse expect? A. Large hands and feet. B. Thin extremities. C. Premature graying of hair. D. Sudden weight loss. Answer: A. Large hands and feet. Question 15. The nurse reviews the lab results of a patient receiving desmopressin. Which value indicates a therapeutic effect? A. Serum sodium of 150 milliequivalent/L. B. Urine output of 3,000 milliliters in 8 hours. C. Urine specific gravity of 1.025. D. Serum osmolality of 320 mosm/kg. Answer: C. Urine specific gravity of 1.025. Question 16. Which hormone is secreted by the adrenal medulla? A. Aldosterone. B. Cortisol. C. Epinephrine. D. ACTH. Answer: C. Epinephrine. Question 17. A diabetic patient experiences sweating, tremors, and irritability. What should the nurse do first? A. Administer insulin. B. Notify the healthcare provider. C. Give 15 grams of a fast-acting carbohydrate. D. Start in 4-line. Answer: C. Give 15 grams of a fast-acting carbohydrate. Question 18. A nurse is assessing a patient with possible Addison's disease. Which assessment finding is expected? A. Puffy face and neck. B. Hypotension and bronze skin. C. Tachycardia and exophthalmos. D. Hyperglycemia and edema. Answer: B. Hypotension and bronze skin. Question 19. A patient is prescribed levothyroxine. What should the nurse teach about this medication? A. Take it at night with food. B. You can skip doses on weekends. C. Take it in the morning on an empty stomach. D. Avoid sunlight while taking this medication. Answer: C. Take it in the morning on an empty stomach. Question 20. Which hormone is essential for the regulation of calcium and phosphate metabolism? A. Calcitonin. B. Aldosterone. C. Insulin. D. Growth hormone. Answer: A. Calcitonin. Question 21. A patient with hyperparathyroidism is at risk for which electrolyte imbalance? A. Hypokalemia. B. Hypercalcemia. C. Hyponatremia. D. Hypophosphatemia. Answer: B. Hypercalcemia. Question 22. The nurse is teaching a patient with diabetes about signs of hypoglycemia. Which symptoms should be included? A. Increased urination. B. Fruity breath odor. C. Tremors and sweating. D. Abdominal pain. Answer: C. Tremors and sweating. Question 23. Which priority intervention is appropriate for a patient with suspected myxedema coma? A. Administer 4 fluids containing glucose. B. Provide a high-protein meal. C. Place the patient in Trendelenburg position. D. Monitor for hyperactivity. Answer: A. Administer 4 fluids containing glucose. Question 24. A nurse is educating a patient about long-term complications of uncontrolled diabetes. Which system is most affected? A. Respiratory system. B. Gastrointestinal system. C. Nervous and vascular systems. D. Integumentary system. Answer: C. Nervous and vascular systems. Question 25. A patient with Cushing syndrome is scheduled for adrenalectomy. What pre-op priority should the nurse assess? A. Fluid volume status. B. Visual acuity. C. Pulse oximetry trend. D. Bowel sounds. Answer. A. Fluid volume status. Question 26. A nurse assesses a postoperative thyroidectomy patient and finds hoarseness. What is the nurse's priority action? A. Encourage coughing and deep breathing. B. Monitor for airway obstruction. C. Suction oral secretions. D. Elevate the head of the bed. Answer. B. Monitor for airway obstruction. Question 27. A nurse is preparing to administer insulin glargine. What is the appropriate action? A. Mix it with regular insulin. B. Shake the vial vigorously. C. Administer at the same time daily. D. Hold if blood glucose is under 200 milligrams per deciliter. Answer. C. Administer at the same time daily. Question 28. A patient with Addison's disease is experiencing hypotension, confusion, and weakness. What is the nurse's priority intervention? A. Encourage fluid intake. B. Administer corticosteroids. C. Reassess vital signs in 30 minutes. D. Place the patient in restraints. Answer. B. Administer corticosteroids. Question 29. Which of the following is a function of the pancreas in endocrine regulation? A. Stimulate aldosterone production. B. Secrete growth hormone. C. Regulate blood glucose via insulin and glucagon. D. Control basal metabolic rate. Answer. C. Regulate blood glucose via insulin and glucagon. Question 30. What symptom is commonly seen in patients with hyperthyroidism? A. Cold intolerance. B. Constipation. C. Bradycardia. D. Heat intolerance. Answer. D. Heat intolerance. Question 31. Which hormone stimulates the adrenal cortex to release corticosteroids? A. ADH. B. TSH. C. ACTH. D. PTH. Answer. C. ACTH. Question 32. A nurse is delegating care of a stable diabetic patient to a UAP. Which task is appropriate to delegate? A. Adjusting insulin dose based on sliding scale. B. Assessing foot circulation. C. Reporting signs of hypoglycemia. D. Teaching foot care techniques. Answer. C. Reporting signs of hypoglycemia. Question 33. Which action should the nurse take first for a diabetic patient who is found unresponsive? A. Check oxygen saturation. B. Initiate CPR. C. Check blood glucose level. D. Administer glucagon IM. Answer. C. Check blood glucose level. Question 34. A patient is taking desmopressin. Which finding requires priority follow-up? A. Slight headache. B. Serum sodium of 128 milliequivalent/L. C. Urine output of 2,000 milliliters per day. D. Mild thirst. Answer. B. Serum sodium of 128 milliequivalent/L. Question 35. Which hormone is released from the posterior pituitary? A. Growth hormone. B. ACTH. C. Oxytocin. D. TSH. Answer. C. Oxytocin. Question 36. The nurse is assessing a patient with potential diabetes insipidus. Which finding is most concerning? A. Blood glucose of 112 milligrams per deciliter. B. Serum sodium of 149 milliequivalent/L. C. Urine specific gravity of 1.030. D. Blood pressure of 130/78 mmHg. Answer. B. Serum sodium of 149 milliequivalent/L. Question 37. A nurse is teaching about corticosteroid therapy. Which patient statement indicates the need for further instruction? A. I will take this medication with food. B. I can stop the medication when I feel better. C. I will check my blood pressure regularly. D. I know this may raise my blood sugar. Answer: B. I can stop the medication when I feel better. Question 38. A patient with diabetes has retinopathy. What is the most important nursing consideration? A. Encourage the patient to drive only during the day. B. Monitor blood pressure weekly. C. Emphasize daily foot inspection. D. Provide materials in large print. Answer: D. Provide materials in large print. Question 39. What does the hormone calcitonin primarily do? A. Increase blood calcium levels. B. Increase phosphorus levels. C. Lower blood calcium levels. D. Stimulate cortisol production. Answer: C. Lower blood calcium levels. Question 40. A nurse is reviewing a patient's medication list. Which drug could mask the signs of hypoglycemia? A. Lisinopril. B. Furosemide. C. Metoprolol. D. Levothyroxine. Answer: C. Metoprolol. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.